Well, here we go. Good evening and welcome. My name is Marcus Mundy, and I'm the Executive Director of the Coalition of Communities of Color. And on behalf of our co hosts, the Portland Public Schools and Multnomah County, I want to welcome you to this panel conversation for communities of color about the most important topic of the time right now, COVID vaccination. As many of you know, the Coalition, CCC, is an alliance of culturally specific community based organizations who work here in Portland and around Oregon. Our mission is to address the socioeconomic disparities, institutional racism, and inequity of services experienced by our families, children, and communities. Our alliance, representing the racial and ethnic diversity of our community, organizes our community for collective action resulting in social change to obtain self determination, wellness, justice, and prosperity. So, as we work with decision makers about the response to the pandemic, we are keenly aware of its disproportionate impact on our communities of color. Not only are we more likely to contract COVID, health outcomes show that we are more likely to have the underlying conditions that increase the morbidity of this virus. Our 18 member organizations here at CCC employ thousands of people of color, many of whom work alongside PPS teachers and staff in SUN and other programs in the Portland Public Schools. And their safety is a chief concern for our member organizations. When this pandemic hit, our organizations immediately began safety planning, adopting protocols to protect those employees, and our members are working remotely and adapting to meeting by Zoom like so many of us. At the same time, our members were quick to respond to the increasing need by our communities. They're providing services remotely and making the necessary adaptation so that families and children have access to basic needs, which means they are providing resource navigation and doing direct service, often driving to a client's home, putting themselves in the direct line of risk of transmission. More often, it means they are on the phone or receiving texts with excruciating regularity, hearing about the needs, challenges, and heartbreaks of our community members. Too many of our members have had to console staff, families, and children about the very real loss of loved ones, the hunger, the fear, the isolation, uncertainty, all the administrative falderall just to get services, all of that. So our member organizations are working with our county health department, including great staff like Charlene McGee and Director Guernsey and Dr. Vines, people you'll hear from tonight. And they're going to provide information and education to ensure our community has the facts so they can make informed decisions about staffing and services. Hopefully, as we look to vaccine distribution, our members are eager to ensure that prioritization utilizes a racialized equity lens to ensure that impacted communities are receiving their fair share of the vaccines. We do appreciate the approach of partnership that PPS has taken in ensuring that all student facing staff and partner staff, which would be the CBOs that work with them, are eligible for vaccination. And I would be remiss if I didn't also mention that there is still work to do in communities of color to build trust and understanding about vaccination. Our communities of color have good reason for our apprehension and reluctance. The history of eugenics, lack of access, racist beliefs around our pain thresholds are just a few of the reasons for our skepticism. And yet, our member organizations are still committed to providing credible information and working to build trust in the community because the threat of this pandemic has wreaked havoc on our communities of color. So we are proud to partner with Multnomah County and the Portland Public Schools in this panel conversation where we will have medical experts that reflect our diverse communities, speak to the importance of vaccines so we can support the efforts to build trust. Like PPS, we understand the importance of returning children back to in-person school, but safely. Tonight, you will hear from amazing health experts, and I encourage you to listen. But at this time, I'm so proud to introduce my good friend, Kim Melton, who is the Chief of Staff for the Multnomah County Chair, Deborah Kafori. Thank you for being a great co-host, Kim, and for your steadfast commitment and leadership during these times. Thank you.
Thank you, Marcus. I'm really glad to be here with each of you today. My name, as Marcus said, is Kimberly Melton, and I serve as the Chief of Staff for Multnomah County Chair Deborah Kafori. And I'm really pleased to be able to offer you some welcoming remarks tonight on her behalf and on the behalf of all of the employees and the public health team at Multnomah County. It's been incredibly, I think it is really important that we're having this conversation today because the students, families, and community members and teachers like you deserve and you want and you need this up-to-date, accurate information, particularly during these times. And I really believe that sharing information, how we do it, when we do it, the ways in which we do it is an important form of inclusion and of equity. Our public health team is really eager to be available to share with the community what we know and to answer as many questions as we can with the information that's currently available to us. And we know that sometimes that changes quite rapidly. At every turn in this pandemic, and there have been lots of twists and turns that we have all weathered as a community, I think Multnomah County's goals have been to plan and shape our response strategy around a commitment to equity. And that has really meant considering the historical health inequities, as well as the disproportionate impacts of COVID-19 as we're developing our response plans and we're creating services and supports for our partners in our community, like our schools, as well as of our individual and family-based services. And I think leading with that lens has been really critical to helping us slow the spread of the virus throughout our community. And it's shown up in a number of different ways. And from the organizing the community testing events that reach specific communities, to providing a wide set of services for people who receive a positive COVID vaccine and have to quarantine and miss work until they recover. And that help that we're doing extends to the entire household. And so tonight, even as we talk about vaccines, our public health team is also going to share with you how we're following the state's guidance and directions in a way that honors that commitment to equity and community, as well as our responsibility to listen and be guided by the science of public health and epidemiology. And I think as we continue to do our part in helping to get our communities vaccinated, we really want this to continue to be a two-way conversation. And that means that we're going to be listening to our community and being engaged in conversation. We're going to be finding new and different ways to support people in making the best decisions that they can. And I think we're going to continue to also work to develop different ways for communities to access vaccine, especially for those who may not be as comfortable attending mass vaccination sites. And finally, I really understand that so many families are anxious to get students back into the classroom so they can be with their students and friends. And while the county ourselves, we don't make that direct decision about when and how to open schools, we're here to help, to share information, to have discussion, to answer questions, because we know it's not a decision to be made lightly, and that even along the way, there'll be steps where we'll need to engage as a community to keep one another safe. And so I want to take a second to recognize Marcus and the Coalition of Communities of Color, PPS Superintendent Guadalupe Guerrero, and the entire team at PPS for all the work that y'all have been doing to continue to support our students and families and our communities so that as we move through this pandemic and we seek to get to the end of it, that we do so, that we don't leave anyone behind, that we don't repeat any of the mistakes that we know we've seen historically in the past, and that we actually move towards something new and better for our entire community. And so with that, I just want to thank you all for this time, and I look forward myself to hearing from this great panel and engaging with all of you.
Thank you, Ms. Melton. Good evening, everyone. My name is Michelle DePass, and I'm a PPS School Board Director. I want to welcome all of our viewers and thank our panel for sharing both your expertise and lived experiences and your Friday night tonight as our community continues to try to stay safe amidst a global pandemic. I'm happy we're all here tonight engaging in this intentional conversation and sharing information through a racial equity and a cultural lens. That lens is important. As both Mr. Mundy and Ms. Melton mentioned tonight, while our community has been impacted by COVID, we also collectively have a steadfast commitment to racial justice and want to ensure that we're offering support to communities of color. As my colleagues and I deliberate strategies to safely reopen schools, the importance of vaccinations in combination with other safety measures is vital. And we know that as educators now have access to COVID vaccines, it'll be a really important factor in our ability to reopen schools. And we know that everyone wants to be able to do that safely. That's why I'm glad that we have the trusted partners in Multnomah County Health Department who can help provide us with the information we need to ensure our decisions are guided by science, but also take into account the multiple perspectives of community, particularly communities of color, in alignment with our values of racial equity and social justice. I know firsthand from my own experience that, in communities of color, because of the history of our city, our country, many of us have doubts about healthcare. We all have a story about a parent or grandparent. And that's why I also thought it was important to hear from experts tonight who not only believe it's safe to receive the vaccine, it's also really important as we try to fight the pandemic. Like some of you, I'm skeptical as well about the medical system, but for this pandemic, I can't personally wait to be vaccinated along with you on the call. We are really fortunate to have a community that wraps around our students, families, and teachers who are here tonight to present and learn. And we're very lucky to have Multnomah County Health Department and the staff. I want to say thank you to Sharon Reese, Jonathan Garcia, and Danny Ledesma for organizing this event and bringing us here together on a Friday night, because this is really important. How we move forward through this pandemic as a community is very important. On behalf of my board colleagues and PPS, thank you so much for joining us.
Thank you, Director DePass. My name is Danny Ledesma, and I'm the Racial Equity and Social Justice Advisor for Portland Public Schools. And I'm very excited to introduce our first panel of speakers, Dr. Joelle Simpson and Dr. Tress Goodwin, both who serve on our PPS Health Advisory Panel, whose purpose is to consult and provide expert, up-to-date information to PPS leaders on the safety and health of our students, staff, and community related to the pandemic. Dr. Joelle Simpson is a pediatric emergency medicine physician at Children's National Hospital in Washington, D.C., and serves as the medical director for emergency preparedness. Dr. Tress Goodwin is an emergency medicine physician at Children's National Hospital and serves as the assistant medical director for emergency preparedness. Thank you for being with us here tonight on a Friday night on East Coast time, and for bringing both your personal, national, and the contextual perspective that will really help our community as we move forward.
Thank you so much for having us. We actually couldn't think of a better way to spend a Friday night about a topic we're both very, very passionate about. To give you some context, working here in Washington, D.C., we both work at a hospital that sees over 100,000 patients in our emergency departments, and we have 3 affiliated with our institution. The majority of our population are Black and Latino, and we have a large immigrant population that we serve as well. I myself am an immigrant to this country. I am a Caribbean American, Black American descent, and I'm very passionate about our communities, about speaking about this topic in particular as it impacts me and my family and the patients that I serve. So next slide. Today, we're going to talk a little bit about the science and medicine side of things, but then also some of the questions that have come up around race and ethnicity, not only in terms of our vaccine questions around the vaccine, but also about the development and the information that's been made available about the trials to get us to the 2 vaccines we have today. Next slide. Both Dr. Goodwin and I were fortunate to receive both our first and second shot. We have tried to be champions within our own community and love having this work on your coast as well in order to share that experience. I look forward to being able to share with all of you at some point sort of the experience of us combating this pandemic, getting to our herd immunity, and ultimately protecting our children. Next slide. I mentioned what we will discuss today. In particular, we're going to focus on the Pfizer and Moderna vaccines and some of the issues that have come up around their production and deployment throughout the US. And so let's just jump to the content. Next slide. So let's talk about the current COVID data. Some of this you've been hearing in the news and the disparities around some of the health issues that's been going on, but also what's been done to try to mitigate some of the disparities that have been ongoing during the pandemic. Next slide. Here's where we are. The pandemic is about a year old, almost, since March of last year. And we've seen certainly a number of spikes and a rolling average, as noted on the New York Times headlines. Currently, where most of us across the country are experiencing another spike, and we're hoping for a downward turn now with the onset of the vaccines that have been deployed. One of the things to note is that while there have been 25.8 million cases, and certainly a large number of deaths and hospitalizations, particularly from our experience working with kids, we do know that a lot of kids are out in the community, but they're part of family units. And so it's really important that we think about this as a disease which most people survive, but will continue to be an issue affecting our day-to-day social lives, interactions, until we're able to put a stop or at least obtain herd immunity with the continued spread of the virus. Next slide. So many of us have heard some of this data. This is data from the Centers for Disease Control, using the reference point to the right of our non-Hispanic white population and seeing the threefold plus difference in terms of hospitalization rates among our Asian or Pacific Islander patients, Black, American Indian, and certainly one of the largest sort of proportion of the population that's been hospitalized as a result of this virus has been our Hispanic and Latino populations. I will say that in Washington, D.C., we were concerned about these numbers that were seen in the adult population and did a study of the children that were coming to our hospital, not necessarily hospitalized, but those that came for testing, and noted a similar proportion in terms of the disparities seen in the various ethnic groups. Next slide. So let's move on to the vaccine itself. The next slide. Let's walk back a little bit in terms of the history of vaccinations. From our scientific lens, vaccines have been one of the most successful interventions of this century. Vaccinations have been successful in eradicating smallpox, certainly reducing polio, rubella, a lot of diseases that myself as a physician have never even seen or had to treat because of their eradication, largely in America and in many parts of the globe. Next slide. When vaccines were first discovered, it was noted that the milkmaids caring for cows that got cowpox were often quite protected from smallpox as well, and thereby having less morbid outcomes compared to others who did not have a prior virus exposure. That lies in the concept of what vaccines are about. They're often a challenge to the immune system to simulate what it would be like to receive the real virus in order to train your immune system to rev up its army so that it better recognizes when the real virus hits so that you can protect yourself from the morbid outcomes of a potential illness. So next slide. Some of the successful vaccines that we have, and we know that kids get these often in their routine vaccination schedule, have been things like hepatitis, diphtheria. Myself, not having seen meningitis in about 10 years, and I've been practicing for 15, as well as many of these other diseases that we're all fortunate to not have seen, much to the success of vaccines. The science of vaccines, and I also do a lot of work in things like the bioterrorism and planning for things like pandemics prior to COVID-19. We had been studying the different technologies in vaccine development that could potentially be deployed if there were to be an outbreak of the various types of viruses out there. In some ways, we are fortunate that coronavirus, at least the class of coronavirus, is not unknown to us. There have been prior coronavirus outbreaks that were quite significant in prior years. And we have had attempts at studying vaccines for those viruses in the past. So while it does seem that the awareness of a pandemic and a virus outbreak at this scale is new to the public, it certainly is not new in terms of the science and what we have been thinking of prior to the pandemic, thus being able to escalate the rapidity with which the vaccine was able to be studied and eventually deployed. Next slide. There have been questions also about the vaccine effectiveness and what does that mean? So when we had the vaccine studies and we had some folks that got a placebo or basically saline that had no medical content in it, no vaccine content in it, compared to those that received the vaccine, we know that significantly less people in the trial that were in the vaccine, that received the vaccine, contracted coronavirus versus those that did not, that received the placebo. And according to the Moderna and Pfizer trials, that was in the range of 94 to 95%. Now, based on the standard vaccine acceptance, the ones that we have issued in the childhood vaccination schedule, that is excellent. Our average flu vaccine that we get every year has to be modified with the different variants on the flu every year. And it is very difficult to really get to that perfect science of what will protect us from the flu. Often that effectiveness is anywhere from the 40 to 60% range. And still we're able to see when the flu vaccine is well deployed that we are able to reduce hospitalizations and mortality from the flu. So 94 and 95% to be studied in the preliminary trials that we've done so far for the vaccines is actually excellent relative to what we've had for prior vaccines that have been gone to full scale in the public. Next slide. So let's focus on COVID-19 because that's really the meat of the matter, correct? Next slide. Here's how I think about the vaccines. More than anybody else, would love to go back to December of 2019 when coronavirus was not such a common word. But right now, the vaccine is while it's a great mitigation measure that we can take to protect us from the virus, it is not a one-stop fix-it to the problem. What Dr. Goodwin and I really want to emphasize in this talk is that this is just one slice of the Swiss cheese model as we describe it. We still need to do physical distancing. We still need to do masks, hand hygiene, avoiding large crowds, a lot of personal responsibilities as you see in the first few cheese slices. And then we're going to have some shared responsibilities, such as the environmental things we can do for ventilation and putting forth appropriate public health messaging. I want to draw your attention to the mouse in the middle, eating at a hole and making it even bigger. Dr. Goodwin and I fondly refer to that as the misinformation mouse. From my disaster preparedness lens and with my expertise in managing emergency preparedness issues, misinformation is by far way more detrimental to solving the issues around our pandemic than the virus itself. It creates greater and greater gaps in our ability to keep ourselves safe when we have misinformation guiding us and therefore causing us largely unintentionally to take risks that are unnecessary in terms of mitigating this pandemic. If we are able to stack up all these lines of cheese, the chances that a hole allows the virus to get from the left to the right and to affect us is much less likely. So the vaccine is one layer, but all the others are necessary in order to truly stay safe. Next slide. So speaking specifically to Pfizer and Moderna, and understand that these two vaccines that have made it to the public are really in the context of dozens of others that have been under study. But there were reasons why these were successful. So next slide. Specifically speaking to Pfizer, the first vaccine, and this is the one that I received personally, that was tested in about almost 40,000 individuals, does have a series of side effects, including some pain at the injection site, headache, chills, fever. I would offer that all of these side effects, or what I like to call more the immune response to the vaccine, were much smaller scale symptoms of what you would have compared to the larger COVID-19 virus itself. And it makes sense that, as I mentioned before, similar to the cowpox, smallpox analogy, that a smaller dose of some factor resembling the virus that is issued to your immune system, knowing that your immune system shows these symptoms and is trying to fight it off is a good sign that is the Army is in training for when the real thing hits. As such, we found that in the trials, it was 95% effective and has been approved in the 16 and over. If we go to the Moderna vaccine, which is the next slide, they had similar outcomes in their trial, testing in about 30,000 participants, 18 and over, similar array of side effects, but also similar effectiveness, both being two doses, the Pfizer being 21 days apart and the Moderna being 28 days apart. And continuing to have ongoing studies as more and more people receive this vaccine in order to truly tell the long-term outcomes of receiving it, but so far with pretty optimistic findings. Next slide. So the question is, who really is benefiting from this vaccine? We know that there's disparities in COVID-19 in terms of hospitalization and mortality, as we mentioned before. So we want, the vaccine manufacturers, their feet were held to the fire. And I will say that you can think of this as so much of the vaccine production process was under the microscope of multiple countries that they had to show and be very transparent in what was happening as they solicited participants for the trials. And one of the asks was that they attempt as best as possible to mimic the population of America. So as you see here, the first column shows the total US population and that breakdown by race and ethnicity. When you look at the numbers in the Pfizer and Moderna trials for the participants that were enrolled, they did their best to recruit similar proportions of the various race and ethnic groups to mimic what would happen on a larger scale population. And then some people say, well, this all happened really probably too quickly. Was it truly safe? Well, remember that I mentioned that vaccine production and this sort of technology around vaccines had been thought of and occurred prior to the pandemic coming to America. But also, it's important to know that the attention being paid to the fact that there have been disparities during this pandemic has been very, very important to the vaccine manufacturers and really to the public health system at large. So next slide. Here's a quick summary of what really happens, right? This is probably a little scary for those of you that didn't love science class, but this is the stuff that truly excites me. If you look at the coronavirus, which is that crown with the red spikes around it, and you were to extract that red squiggly line, which is the actual mRNA that you hear about, and that's the vaccine. So that's that purple circle in the middle. When that is injected into your bicep muscle, it goes into one of your cells. And think of the cells having this, like your cells is a mini house, and it has a copier machine in its living room. The copier machine is something called ribosomes that uses the mRNA to develop proteins. So to produce a blueprint of proteins that need to be manufactured by that cell. Well, if someone put in a blueprint that isn't normally made by your body for the proteins your body normally needs to make, but it's a blueprint of what happens on the coronavirus for that spike protein, then all of a sudden the cell is producing these spike proteins, and as it starts to show it on the outside of your house, your body says, this is not a protein that's supposed to be in our body. Let us fight it off. And so your immune cells, as you see, develops antibodies and starts to attack those spikes. Now, the spikes aren't the virus itself, but it is the armor of the virus that your body recognizes and learns how to fight off without having to have the virus in it itself. So questions about whether you shed the virus after you get the vaccine, questions about whether this goes into your DNA, questions about whether this stays in your system, those do not actually happen because that copier machine that sat in your living room, it eventually disintegrates and dissolves and is no longer functional over time. However, what's most important is that army of your immune system has now been trained to recognize the most recognizable part of the coronavirus and then safely be able to fight it off when you need to if you were exposed to the virus itself. Next slide. Dr. Goodwin is going to start talking a little bit more about the safety profile of the vaccine, and then we'd be open to any questions that you might have.
Thank you so much, Dr. Simpson. So getting into more details of these vaccines, And as Dr. Simpson mentioned, these trials showed that these vaccines were both safe and effective. In fact, the threshold the FDA set was 50%. And the fact that both of these mRNA vaccines were over 90% was actually quite a surprise and incredibly exciting and encouraging. And again, when we talk about side effects, like Dr. Simpson said, it's actually the body's response. It's the body doing what it needs to be doing to create this army of protective antibodies. And most of these are mild to moderate, based on myself and a lot of people, fellow healthcare providers that I know. The response was felt within about 12 hours, and it lasted about a day. And just felt achy. But by the following day, I felt great and back to normal. Next slide, please. So how are we doing in terms of getting the vaccines to people here in the US? As you've certainly heard, the rollout has been a bit rocky, but as you can see here, we're picking up the pace. So right now, we're averaging about 1.3 million doses a day, and the goal is to get higher than that. So we're heading in the right direction. But considering the population of the US is about 330 million, and of these vaccines, everyone needs 2, we are a long way off before we meet the goal herd immunity, which is about 70% or more that we anticipate we need to protect the community at large. Next slide, please. So there has been some early warning flags about racial equity in terms of vaccines by race. And we've seen that there's been lower rates of vaccinations when compared to the total percentage in population for both Black and Hispanic residents of Oregon, with quite a significant disproportion for Hispanic people when you consider compared to rate of infections. So if you can see in this graph, you can see when the cases, which is that second blue line, is much higher than the vaccination rate, that we're not doing a good job of really targeting the most vulnerable. And what are the reasons for this? There are likely many. You likely need the internet to sign up for a site. And if anyone's tried, it can be confusing. You'd have to have transportation to the vaccine site. You might have to take a day off of work to get that vaccine. And many might not be able to do it. So what these early numbers are showing is that we really need to work hard to make these vaccines and these appointments accessible to those who need it most. And this trend in Oregon is pretty consistent throughout the country. Next slide, please. So now we're going to talk a little bit more about perceptions of a vaccine. And we all know that the decision to get a vaccine is a personal one. So this survey asked if a COVID-19 vaccine was determined to be safe by scientists and free for everyone who wanted it, would you get it? And as you can see, and this is encouraging, the rates increased from the same question since September to December. But breaking it down by racial and ethnic groups, you can see that Black respondents in this study were less than both white and Hispanic, with 62% saying they definitely or probably would get the vaccine, compared to 71 and 73% respectively for Hispanic and white respondents. So definitely, I think as the information has been out there and we've worked at combating that misinformation mouse, that the rates of acceptance and trust has improved, but there's still quite a long way to go, and we really need to target the groups that are most skeptical. Next slide. So this is building off that same, just building on that same study, delving more into these concerns. We can see that the top reasons for this hesitancy really do vary among groups. And the most is trust. So worried about the possible side effects and then not trusting the government to make sure that the vaccine is safe and effective. Other things people cited is it was too new and they wanted to wait and see how it works for other people. That politics had an impact on the development process, that the risks of COVID-19 are being exaggerated, and in general distrust of vaccines, not trusting the healthcare system, worried that they may get COVID-19 from the vaccine, and don't think that they're actually at risk for getting sick from COVID-19. So moving on, we're actually going to talk about some of those myths here in the final part of our presentation, and then we will be around for a Q&A for any other questions that do come up. So next slide. So myth number one, we can't trust the COVID-19 vaccines because they were rushed. Well, yes, the vaccines were created in record time. And however, this technology, the mRNA technology with the vaccines, has been in development for over the past 3 decades. And this is the first time we've actually used the technology to create a vaccine that's been rolled out. One thing that's often not known as Moderna is, if you actually break it down, it stands for mRNA, or that's the that's what it's based off of. And so they've been around for a while, and their whole technology is based on mRNA vaccines. Dr. Simpson uses a great analogy that, yes, it was incredibly fast, but if you think about it, the entire world was focused and everybody was focused on this. So if you think about cleaning your house, it might take you to really do a deep clean, like 12 hours to really get into the corners and get everything done. But if you hire an army or a lot of people to do it, that they're really good at it, they can do it within an hour or 2 hours. So the entire focus of so many scientists over the last year has been solely focused on finding a vaccine for this particular disease, which is unlike any time in history. In addition, just knowing the FDA, how their process works, they require that they follow up with the volunteers for 2 years after receiving the vaccine. And they are checking on them very, very regularly. And so oftentimes too, in other trials, it takes a while for enough people to get sick naturally. So they didn't expose these volunteers. They just had to get sick in the community and see what happens. And because of how prevalent COVID-19 is, it actually took only a few months, unfortunately, but fortunately that it sped it up, for them to collect enough data to make the initial evaluation and then apply for funding or apply for approval from the government. So the FDA, independent panel of vaccine experts, they really looked at the data and they deemed it safe. And similar panels across the world have looked at this and deemed them also effective and safe. So next slide. So myth number 2, the vaccine will give me COVID-19. And if you remember from that very exciting slide with all the squiggly lines and circles, the vaccines actually only have a piece that codes for, that's the blueprints that go into the copy machine for the spike protein. So it cannot cause the disease. They don't even use an inactivated form of the COVID. Another myth is that if you get the vaccine, you could get a positive COVID test within a week. You can't. It's the same thing. The tests themselves, when you get a swab up your nose, that's looking for the actual virus and not the spike protein. So that is another myth. That fatigue that some people might think is COVID, again, that's just your immune system responding. It's working really hard to create all those antibodies, and they're keeping them in your body to fight off when you may get exposed in the future to make sure you don't get sick. Next slide. So I already had COVID-19 and I won't benefit from the vaccine. So we don't know how long natural immunity lasts, which is the immunity that you would get from getting the virus. So those of us who had chickenpox as kids, we are protected for the most part from getting it again. But we don't know how that works with the coronavirus. There have been instances where people have become infected twice, and they know it's 2 distinct infections and not just a continuation of the first. We do know that from the lab tests going on that the immune system's response appears to be stronger from the vaccine, and it likely creates more immunity possibly than someone who is infected with the coronavirus. And that's not unheard of. For instance, we know that from other vaccines, the vaccination itself gives more protection, such as with tetanus and the pneumococcal vaccine. So we are learning more about this, but right now everything looks like it is pointing towards very much needing to get a vaccine. Myth number 4. So since COVID-19 survival rate is so high, I don't need a vaccine. Well, most people do survive COVID-19, but depending on your age, you're at much higher risk for severe disease and on the older side, death. And you've seen probably a lot of these stories about these long haulers, and these are people that are still experiencing symptoms months down the road. We know the virus can cause damage to the lungs, to the heart, to the brain, and we're still learning about it. And estimates of these 10% of people have effects from the virus beyond months beyond their actual infection, and some people losing their sense of taste and smell that still hasn't come back almost a year later. So even if you survive, there are a lot of potential risks for long-term effects. And myth number 5. Once I get the vaccine, I won't have to wear a mask or worry about social distancing. And if you remember that Swiss cheese, which is one of our favorite graphics, we still have to be part of that. A big reason, there are 2 big reasons. The first is that when both of the authorized vaccines require 2 doses given 3 to 4 weeks apart. That first vaccine primes you, and then that second one really gets your army ready. And they predict that after the second vaccine, it's about 10 days to 2 weeks before your body's really at its maximum. So that's about a 6-week window where you're really absolutely have to be 100% protected. The second big reason is that the vaccine trials really only focused on measuring severe disease and death. So they didn't measure if someone got infected, had mild symptoms, or didn't get any symptoms, asymptomatic. So we know that they do a very good job protecting from severe illness and death, but we still don't know if someone who's vaccinated can get an asymptomatic infection and then spread it to someone else. So for that reason, we still have to protect those around us, wear a mask and distance. We will learn more over the coming months, but for now, we shouldn't change our practices. All right, and that is our last slide.
Thank you, Dr. Goodwin. I have a few follow-up questions before we move on to our next panel. I'd like to take us back to that myth number 5 and the slide around the Swiss cheese model. I'm wondering, Dr. Simpson, when we think about all of the different slices of cheese that are important, not only vaccination, and we think about communities of color in particular who may have different work schedules or less access to different elements in each of these. Are each slice of cheese equally important? Are there certain slices of cheese that are more effective in combination with a vaccine?
I think certainly, I think about more important being what I have control over most versus what I rely on my community to support. And we do know that from the public health numbers, as we see, there are certain zip codes, certainly the zip code I live in, which is one of the most prevalent areas for the COVID virus, at least in terms of people that are positive cases in all of Washington, D.C. So what's important is that I wear my mask, I wash my hands, and I avoid crowds in my neighborhood. Do I hope that the rest of my neighbors also prioritize things like avoiding crowds and not going to the grocery store and having their mask under their nose? I do. But in terms of the individual person, what is really most important, I think, is what you have control of. If you're able to maintain that, I think that gives me some peace of mind that I did the best that I could to protect myself and others and not perpetuate that issue in my community.
Thank you. I have another question. When you discussed the latest map and case count in the country, you talked about herd immunity, and I'm wondering if you could come back to that and describe to us what you mean by what is herd immunity. How will we know if communities of color are included in that herd, and what is the role, do you think, of vaccination in getting to herd immunity?
So herd immunity is the level that we need to get to where everyone has protection from the virus, whether it's from having had the disease or the vaccine. And we know that obviously the vaccine's a lot safer to reach that level in order to kind of let it die out, let the virus not have enough hosts so that it can no longer stay around. The prediction, and it's hard to know, but right now the prediction is we need to reach at least 70%, but probably closer to 80 and 90% of the population in order to really have this virus go away, or at least at a level that's manageable. Can you remind me the other components of your question?
Well, I just wonder, as we think about how there has been so much disproportionality in who's getting infected by it, when we talk about that 70% or that herd, is there a nuance in terms of communities of color being represented in that herd immunity figure?
So what's important is to think that herd really has to be within your community and who you interact with. So if it's 95%, in another zip code, but not with people that you interact with, it doesn't average out. So if one community is 50% and the other one's 100%, that doesn't mean that you got to 75%. It really has to get to that scientific threshold. And it just shows how much we really need to work together as a community, and how even more so we really have to rely on our neighbors to get vaccinated, to do all of those measures of our Swiss cheese to make sure that it doesn't spread. And it's a lot. It's a heavy lift. But it's a lot.
I would add that our communities of color then are extremely important. When the numbers are showing that the prevalence is highest in those communities, we have to work that much harder to get those numbers down. And in terms of mounting enough armies and all those individuals in order to protect each other from the continued spread. So they're absolutely part of the herd.
I'd like to talk to you and ask some more questions about the safety of the vaccine. I think that one of the questions I have for you as experts, as health experts, what advice do you have to people when we hear and read really sensational headlines in the news about safety and the safety of the vaccine? What would you sort of give? What factor of safety would you have us hold on to as we read the newspaper or we see what's on the latest on the internet?
Yeah, this question is reminding me of a question I've had with my family who are international. I was born and raised in the Caribbean, and they're getting the US news and freaking out that I'm going to grow a horn after my vaccine. And certainly, I think what has been really important is me remembering when I was growing up and there were no rules of having to have a kid with a car seat or a kid with a seatbelt in the back seat. And certainly airbags weren't part of cars. But now my parents would never drive a car without a seatbelt, without airbags, and without making sure that my nieces are seatbelted in the back seat with a car seat. And so I think about that, right? Back in those days, nobody thought about the dangers, and many people survived not having those safety precautions in place. But now that we have the data and we know more information about who is more likely to die in a car accident, to protect our family and friends and ourselves, we make sure those safety measures are in place. I think the same of the COVID vaccine. If you protect yourself with mask and hand washing and distancing, and eventually one day get the vaccine, you are increasing those slices of cheese to favor your bets in terms of surviving the pandemic. And it's what I would want for my family, just as I put my niece in her car seat in the back of my car and put my seatbelt on and make sure the airbags are working. It's a similar concept, in my opinion. There's really very little difference there.
I have one more question, and then we'll transition to our next panel. You talked about in myth number 1 about trust, and trust was a really huge factor in one of the reasons why folks may or may not want to get the vaccine. And I'm wondering if you can talk a little bit about the worry about the vaccine being rushed and that relationship to this slide right here, where we see that there was a proportionate number of people of color in the vaccine trials. And I wonder if there's something that you can pull out of that in terms of communities of color specifically trusting the timeline because of the participants in the trials.
You know, that's a tough question, and thank you for asking. My response to that is I get it. I read Tuskegee. I read about Henrietta Lacks. I read about the history and actually lived and worked at some of the institutions where that stuff occurred. Today is a new day is the best that I can say. The microscope that has been on these vaccine trials and the attempts in order to sort of mitigate as much as possible the outcomes that we might have on our communities of color. I think this is unprecedented in science, particularly as a leader at my institution and speaking with many other groups of Black and Latino and other populations. We are holding their feet to the fire in terms of my colleagues who have been working at the NIH, seeing that, one of the leaders in the vaccine trials was an African-American physician who has been there and being accountable to the data. I'm not saying that science is perfect. I am saying it is appropriate to question and challenge when this is really a life and death issue. But what I will say is that the transparency and the information that has been shared, and with my knowledge as a Black woman in America and with a family that I want to keep safe, I fully trust and support what was done to make sure that this trial, that these vaccines were done in an ethical and appropriate manner to consider my population and the people that look like me. And really, I really say that with a lot of passion from a personal standpoint. But I do think that, that has been echoed by many of my colleagues of all colors across the spectrum for the way that this was rolled out.
Well, I just want to thank Dr. Simpson and Dr. Goodwin. I know that as someone who's not very great at science, I could listen and learn from you all night long. But we are going to move on, and I just want to remind folks who may be watching is that Dr. Simpson and Dr. Goodwin are part of the PPS Health Advisory Council panel and are frequent panelists with our school board. And so if you would like to hear more information, we'll of course link this presentation. Would also encourage folks to visit some of our board meetings when we've had their expertise and presentations. Thank you very much. We're now fortunate to have even more experts and partners with us. I think that one of the things living and working in Portland, I feel so fortunate to have Chair Kafori's leadership and the expertise and experience of so many leaders throughout Multnomah County who are our partners and who are working tirelessly day and night on wanting to fight the pandemic and really making sure that ensuring that our communities are safe. So I'm so honored and appreciative of our next panel. These are folks who are leaders in our community, and we are just so fortunate. So please join me in welcoming Jessica Guernsey, who is the Director of Public Health for Multnomah County, and also Dr. Vines, who is the Tri-County Health Advisor. We're also so excited to have Charlene McGee, who is the Program Manager and leads the Racial and Ethnic Approaches to Community Health, which is on the next slide, if we could have the next slide, which is called the REACH program in Multnomah County's Health Department. So please join me in welcoming them.
Hey everybody, can you hear me okay? Great. My name is Jessica Guernsey. I'm the Public Health Director at Multnomah County Health Department. It's a real pleasure to be with you this evening. Hello to PPS community, and thank you for all your amazing work. I'm a 3-time PPS parent. Go Franklin. Sorry, I'm probably not supposed to endorse a single school, but all 3 of the kids either went there or are there and can't wait to go back. So thank you all so much. I know you're working tirelessly to support families, the community. Really appreciate it. And we miss you. So I'm gonna jump into a few slides here, and I think Dr. Vines is just gonna jump in with me, and we're going to go over a little bit about what we're doing from the public health perspective in terms of supporting vaccine activities. And I'm going to give just a little bit of background. Unfortunately, I feel like my role right now is to give a reality check on where we are with vaccines, just to make sure we're all on the same page about what's going on, because I know it's been really confusing given all the different folks that have been sort of queued up to get vaccine right now when we actually don't have a lot of vaccine. So I want to make sure to share some information about that. And then I want to touch on, as Kim Melton said, sort of our core values on how we're trying to express this work in our role as your local public health authority. Next slide. So I'll talk a little bit about, I'm not going to talk much about the safety and effectiveness. Actually, the two doctors from DC, I love DC. I'm actually originally from DC. Sorry, I'll stop making mention of everything in a minute here. Did an excellent job with the background, the scientific background. That was wonderful. Our goals really are with the vaccine are to talk about, or to ensure that there's a reduction in transmission, severe illness, and death. That's, as we just talked about, that's part of the Swiss cheese model. The vaccine fits into this. It's not the only thing that we have, but it's a very important tool in preventing illness and death. We also really are looking to minimize disruption to society and the economy, including maintaining healthcare. We are all in the midst of school reopening discussions right now, so this becomes an important part of that conversation. But then also really one of our biggest roles in public health around vaccine is assuring equity. And that can mean a couple different things. That can be directly in terms of the services that we're doing and the outreach and the community partnership that we're doing, but it also means working with large systems like hospitals and healthcare to make sure that they're thinking about access and how they're delivering services so that many people can take advantage of those services. Next slide. So this is a map on the COVID-19 Oregon website. And I think Dr. Goodwin put it well when she said that we got out to a rocky start with the vaccine rollout. We did. It was very rocky. It's been an unprecedented effort in getting out this vaccine at the magnitude and scale that we're undertaking right now. So those numbers are still fairly low. So that middle number shows about 56,000 fully vaccinated people in Multnomah County. And then the other two numbers give a sense for the number of people that are on their way to full vaccination. So our numbers in the next couple of weeks, once we see many folks who are getting their second dose, those numbers will go up, but they're still relatively low. Part of the reason for that is that in Oregon and across the nation, we don't have a plentiful supply of vaccine yet. So that's something that I'm going to talk just a little bit about. Next slide. So where we are right now, and I know I think someone later on is going to talk a little bit more about the specifics related to vaccine access for educators, school staff, and childcare. But where we are right now in Multnomah County in the metro area is that we actually still aren't done with the 1A group in the vaccine categories. The 1A group is inclusive of healthcare workers, long-term care facilities, and congregate settings. We have a very large population in Multnomah County in the metro area. So we are actually still working on folks that are in the 1A group. In the metro area, one of the ways that we express equity in the work that we're doing in the different phases of vaccine is that we look at categories like folks in the 1A healthcare worker category, and we've prioritized different groups within that category to make sure we're focusing on equity. So that would include things like working with community health worker associations, medical interpreters, medical transportation workers. So not just clinicians and folks in the hospital setting. So really looking at the whole body of folks that are working within those settings to make sure we're elevating those categories of folks that we really want to make sure have access in this first wave. That being said, we actually still have quite a few people in that category. So that's one of the reasons you're seeing, a fairly slow rollout, because there's a lot of people and there's not enough vaccine. This week, there's several waves of educators and childcare providers that have been added to the eligible list for vaccinations. So this is the first week that group has been rolling out through school districts, childcare centers, and we have very large vaccine pods or vaccine clinics in the Portland metro area that have been the main point of access for this first wave of vaccinations. This is another area that we're looking at right now to ensure equity, not only in the large pods that are being stood up now, but we're beginning to see a very distinct group of people in smaller child care centers in East County that are most likely not going to access these large pods. So right now, what we're doing is looking at how do we step into that gap and make sure that there's an access point that really is not only geographic, but also is taking into account all of the important issues that were discussed at the beginning of the presentation regarding trust, partnering with culturally specific organizations, making sure it's, in an area of town that's accessible. So these are all of the things that we're starting to look at right now to understand where we in public health at the county need to step in and make sure there's an option for people. And then after multiple weeks of educator and childcare providers, because that also is a very, very large group, we'll start to roll into the age brackets. So beginning February 8th, folks that are 80 and older will be able to, will be eligible for vaccination in Oregon. Again, we will be applying an equity lens to the work that we're going to be doing in this age group to make sure we're placing any work that we're doing around vaccination clinics and outreach within places that people already go and trust. So right now we're beginning to talk to FQHCs and community health centers and all of the community-based groups to figure out what's the best way to approach this to make sure we're reaching people where there's a trusted source of information and places that people just normally go to get their healthcare and their health information. And all of this work really relies on strong partnership strategies. And my awesome colleague, Ms. Charlene McGee, is going to talk about really the expression of what that looks like in one particular partnership model. But all of these different on-the-ground strategies require us to be working in close concert with culturally specific community-based agencies, childcare centers, schools, and healthcare to leverage enough capacity to see folks. Next slide. So what's coming next? As I mentioned, right now we're still addressing folks in 1A. We're starting to roll into the educator and childcare groups, which again, we expect to identify gaps for people along the way in the next couple of weeks. And that's again, part of what our role is to understand from the community, what is going on? How are people accessing services? Is it working? And then we'll be, working with partners along the way to figure out how to address some of those gaps. But just to sort of set sort of the long range, this week, or excuse me, next week, the Oregon Vaccine Advisory Committee at the state is finishing up recommendations for the next few groups of people that will be eligible for vaccine. So we don't know exactly how this is going to land, and we will be taking guidance from the state as well as looking at our own local data and listening to what our communities are saying about access to vaccine. But this could include critical workers in high-risk settings. So this could be industries essential to the functioning of society and substantially higher risk of exposure. And this would be outside of the healthcare worker setting. People of all ages with underlying conditions that put them at moderately higher risk. People of color or BIPOC communities at higher risk for severe population and the general population. So we expect to see recommendations coming out of the state next week to understand what are those next groups of folks going to look like and how are we going to start to plan for fully vaccinating those groups. Next slide. And I will turn it over to Ms. Charlene.
All right, thank you, Jessica. So good evening, everyone. As it was said, my name is Charlene McGee, and I work as the REACH Program Manager. And this evening, I have an opportunity to share with you one example of the amazing work of public health professionals within Multnomah County Health Department. The program that I manage is called REACH, and it stands for Racial and Ethnic Approaches to Community Health. We are one of 31 grantees funded by the Center for Disease Control and Prevention to address Multnomah County's Black and African immigrants, the health disparities that exist around chronic disease. We do our work in partnership with community, embedding our community wisdom, ensuring that the lived experience and voices of the community are blended with our evidence-based proven public health strategies. Next slide, please. Back in October, which seemed a long time ago, we were awarded as part of our REACH grant of a flu vaccine grant from the CDC. I would definitely say as we approach that work, because in as much as we are public health professionals, we are also members of the community that we work for and work with and work on behalf of. We approach this work really acknowledging and understanding the impact of racism, the impact of Tuskegee study, Harriana Lacks. It definitely goes on and on. As we started to roll out, we really felt that it was important to recognize the impact and the trauma of those historical implications in terms of how it affected the campaign conversation and work. So what you're looking at is an adoption from a statement from our colleagues in Minneapolis that we use to share and acknowledge what comes with vaccine conversation. I'll definitely say, as we continue to do the work, we have alongside with our community, watch and seeing the community evolve and understand and seek out further information so that ultimately they're making the best decisions for themselves, their families, and community. Next slide, please. So here in Multnomah County, as well as throughout the United States, we have what in public health, what we refer to as the chronic disease burden. We know that nationally, 60% of Americans suffer from one or more chronic disease. Here in Multnomah County, we know that among our 10 leading causes of death, we know 8 of those are chronic disease. Research, both in terms of public health and medical science, tells us that having one or more of these diseases increases your risk of contracting flu and COVID. We also know that having chronic disease, if you contract flu or COVID, your symptoms sometimes may be worse. That may result in increased illness, hospitalization, and sometimes death. Hence why we felt like it was important to really incorporate vaccine education as part of our ongoing efforts. Next slide, please. As we've continued to do the work, we have forged different partnerships with government entities as well as our community. What you're looking at is a slide of a partnership that we did in partnership with the city of Portland. And if you've been driving around town, you've likely seen the billboards representing a public health COVID campaign. We also partnered with the Portland Art Museum, where we have incorporated art into different settings, acknowledging the impact of COVID-19 in communities that have been impacted by COVID at disproportionate rates. Next slide, please. Next slide, please. So as I mentioned, we were funded to do the work in connection with our ongoing REACH program. And as you can see from the slide, it's really just to show the commonality between COVID-19 as well as flu. And as you can see, the similars are quite similar. Part of our work as we've gone out to do, it's been very important and critical that we incorporate both messaging about COVID-19 as well as flu in this flu campaign. Next slide, please. As I mentioned, partnership is central to all that we do. Our work remains community-informed, community-driven, ensuring that we're pivoting, we're adjusting, and we are innovating during these times that we find ourselves in. As we sought to do our work, we have forged partnerships with entities like Portland Community College, where later on you'll see a slide where we have weekly drive-through flu clinic. this image you're looking at the drive-through plus mobile clinic, it's actually from one event that we partner with Rosewood Initiative during National Flu Influenza Week, where we held a drive-through clinic within their parking lot. Because of the COVID pandemic, we've had to shift our operations and really be intentional and strategic about how we're partnering to ensure our work is done safely. Our work also remains data informed. We use data looking at our geographic layout, looking at communities that have been most impacted, and rolling out our strategies to ensure that we're responsive to the work. Additionally, we also recognize that we have to be culturally specific in terms of how we roll out our strategies. With our campaign, we've organized virtual community forums, and we also have digital media campaign as well as PSA, again, that really lifts up and acknowledge the cultural strength and resilience of our community, ensuring that the voices and the culture remains woven throughout our public health work. Next slide, please. So this year is an example of some of the work that we have underway and that will continue. It represents community members who we have engaged with, who believe in the effectiveness of the vaccine and have signed up and agreed to be our multiple flu fighters. They've given us permission to share their image as well as quotes speaking to their why for being vaccinated. So next slide, please. So again, these are images from our digital media campaign that is likely you're on social media, you've seen it. Again, speaking to the, combining both the flu and COVID, as well as speaking to identify populations, populations that we identify as priority, and getting messaging out to encourage flu vaccine. Next slide, please. As I mentioned, we have really stood up very innovative partnerships. All of these are locations within the county that offered drive-through COVID testing, and as well as the PCC location, we offer the flu vaccine. With that effort, one of the things that we've realized as we have engaged with our community is that the community have told us the reason why they decided to take this step is really to protect themselves, their family, and their community. And at the bottom there, you can see the link to the website where you can go and access the information about testing sites as well. Next slide, please. So yes, we are towards the end of January. However, it's never too late to get your flu shot. As long as the flu virus is around, we encourage you to get the flu shot if you fall within the priority population. Reach out to Multnomah County Health Department as well as your medical provider to make sure that you're receiving what you need to keep yourself and your family safe. Next slide, please. Again, this slide represents two partnerships that we currently have, one with our partner at the Urban League of Portland, as well as Highland Haven. These are mobile testing sites that our community members have asked us. And, these are trusted locations within the community where the community know and the community trust. So we've been offering these opportunities. Again, these services are open to anyone to access. They're drive-through and walk-up. So feel free to utilize the services as you're able to. Next slide, please. Again, I spoke a little bit to our efforts around culturally specific virtual events. At the bottom there is an image of a very successful fun event we held via Zoom that had over 200 attendees, where it was our first vaccine education event. We have 3 more planned, and the next couple of slides will show them. The next one we have coming up is on February 18th. Again, all the information that we're offering are available to everyone. And then we have another event on the February 25th. That event is prioritizing our African immigrant and refugee population. And we have an event on the 21st, partnering with Faith Partners. Again, all the information can be found on our social media site. Next slide, please. So as I prepare to wrap up, we definitely want to remind folks to protect yourselves, your family, your friends, and your community by getting vaccinated. As it was shared in the previous slides by Dr. Simpson and others, we know that vaccine remains one of our vaccine is one of our 10 greatest achievements in public health. We encourage community members to seek out trusted information to make sure that you're making an informed decision to protect yourself and your family. We also encouraging folks to sign up with the V-Safe, which is the CDC monitoring effort to track any health effects from vaccine. Share your experience by posting on social media and encouraging others within your network to access vaccine as well. And next slide, please. So as a reminder, the COVID pandemic remains present with us. Even after getting your vaccine, we encourage you to adhere to all these different public health measures and guidance to hopefully get us to return back to normal pretty soon. And next slide. So this slide represents another campaign that we did in partnership with our partners at City of Portland. We encourage you to visit the website, portlandstrong.org, to take a pledge to commit to remaining COVID safe and Portland strong. Next slide. Thank you.
Thank you so much to our panel. I just have a few follow-up questions. Charlene, thank you so much for sharing the slide about the acknowledgement of the trauma of vaccines. We're going to go back to that slide. And I'm wondering, as you've heard from not only from you, from Jessica, from our earlier panel, the role of trust and building trust is so important. And I just wonder, in all your experience and working with so many of our partners and really sort of meeting the community where they're at, I'm wondering if you had the opportunity to talk to employers, say a large school district, what advice would you give not only employers but policymakers and healthcare employees in making sure that information is really being received by communities of color in a way that's building that trust?
So I'll definitely say trust is central to everything that we do. I think in addition to trust, relationship building is critical. I'll also say authentic engagement. Approaching the work in the sense of humanity, really stopping to listen to address the concerns and reiterating the facts of what we know to be right and to be effective around public health messaging. I know definitely we also have to acknowledge history, right? History, both in the past and oftentimes, and unfortunately, we know some of those incidents also repeated in the now. Acknowledging that and providing opportunity and bridge to really foster and cultivate relationship that really, that really brews trust. I'll say, and I think especially around this work, one of the things I referred to also is that we also have to, we move at the speed of trust, right? Our ability to cultivate trust helps the community to move along. And I think trust is just important. I'll definitely say trust, community engagement that's authentic and that really seeks to listen to the community as well as providing factual information.
Thank you. As you presented the slides that had the future information sessions, and as you've been doing this work, particularly around like the flu vaccine and making sure that you're working with communities, I'm wondering, as you all heard the myths, the common myths around the COVID vaccine, is there a myth that you think particularly resonates with Multnomah County residents who are people of color? And which myth might you sort of give us advice around how to really focus on sort of building trust and more information around that myth?
I'll say there's definitely tons and tons of myth. And one of the things, the common thread I would say that I have seen, heard, and observed with myth have really been around misinformation. So honestly, as much as I know, and we all know that myth exists, what I'm also really intentional about doing is pivoting the conversation to the facts of the science and the facts of public health. I think, I reflect even as I'm also a PPS parent, even through those conversations and talking to parents, I've seen too that we as a community and public, right, we have not, we don't understand science. We don't understand how the immune system works. We don't understand vaccine development. And here we are. So I think opportunities like this and other forums that allow the community to listen, to learn from public health and medical professionals, as well as giving the community opportunities to share and ask questions, we found to be very useful and helpful.
Could I chime in on that question as well?
Absolutely.
Yes.
Great. I just want to say I often get asked what's actually in the vaccines, and that's publicly available. It's online, but I just like to make sure people know there's no fetal cells, there's no pork, there's no eggs, there's no latex, there's no mercury, and the ingredients are available on the Centers for Disease Control website, and I often point people there and tell them exactly where to scroll so they can see for themselves.
Yeah, and I mean, I would also say additionally, I think around some myths that I heard too with among our immigrant and refugee communities, I've heard things like if I've had, malaria means that I'm protected from COVID. That's not true. Very different virus. Having malaria does not protect anyone from COVID. I think also to what Dr. Vine spoke about, I think also people have been concerned about the speed of the vaccine development, but we had that question answered. I also think, part of it is there's just so much information out there and people are just oftentimes unsure of where to go. And I think, guiding and directing folks to the right place to find information to fact check have also been helpful.
All right. Well, I just want to thank our panelists tonight. There's so much information and so much expertise. And I have to say, as someone who's lived in Portland, it's so great to see how there are so many common partners between Multnomah County and Portland Public Schools and the Coalition of Communities of Color. We really are just fortunate to live in such a strong community. And so I want to thank Jessica Guernsey, our Director of Public Health, Dr. Vines, and Charlene McGee. Just thank you so much for continuing to partner. And there, as you saw, Charlene moved through her slides, and there were some really important continued ways that we can have conversations. So we'll make sure that we want to make sure that people continue to refer to these information sessions. And so the other folks I want to thank are Dr. Simpson and Dr. Goodwin. Thank you for making science on a Friday night so accessible, and thank you for all the work that you're doing. And as we referred earlier, as our employees at Portland Public Schools and student-facing partners are aware, we are in Wave 1 for vaccinations at the Oregon Convention Center. And we're informed today that we have Wave 2 appointments will begin Monday at noon. And so we wanted to make sure that folks saw the information about the waves who are eligible here. And then for PPS employees and for our partners and anyone who wants to learn more, we want to encourage you to visit our website, which is posted on the next slide. And our website will continue to update it. You can see that there's lots of information here. We will make sure that a recording of tonight's discussion is on that website as well. And so we want to thank everyone and thank our panelists. I'll turn it over to Marcus Mundy, who's going to go ahead and close us out for the evening.
All right. Well, I have the best job of the night. I get to let everybody go. But again, I know Danny thanked everybody. I just wanted to thank and acknowledge our very illuminating panel of speakers from all over the country. So that was great. I wanted to thank everybody for tuning in. And as the health experts you heard from tonight, remind us, please, wear a mask, stay socially distant, wash your hands. If you're eligible, please get vaccinated. And I'll leave you with, as the Reverend Dr. Martin Luther King Jr. reminded us, we are all part of this interconnected fabric of humanity, and it will continue to take everyone in our community to be safe and beat this pandemic. So please enjoy your weekend, enjoy your evening, good night, and please be safe. Thank you.